Welcome to Surviving Your Brain, where I get to talk to people who have had or currently have a neurological disorder about what their experience has been like. And so today we're going to talk to somebody who has had a stroke, and we're going to find out all about his experience, what his recovery has been like, how he's doing today. And I think that his story is going to be incredibly powerful. So we're just waiting for him to come on. And once he comes on, we will get started. Let's see. And for those of you who don't know what a stroke is, so when somebody has a stroke, that means that for a period of time, there's an interruption of blood flow to a very specific area of the brain. So it doesn't impact the entire brain, it's to one specific area. And depending on what area of the brain has been impacted, that determines the kind of symptoms that the person is going to have. So I see that he has now joined. So let me take a look and see if we can go live with him. Oh, Devin, there you are.
Doc, can you hear me okay?
Yeah, I can hear you fine. Can you hear me?
I can hear you great, man.
Thank you so much for doing this.
Absolutely.
Like we talked about, you've got a really powerful story that can help a lot of people. And I think one of the things that's so powerful about your story is that, one, you don't fit the typical description of what we think when somebody's had a stroke. You're young, right? So people always think it's going to be somebody older. And two, you look like you're doing well. Somebody looking at you would never be able to tell that you've had a stroke. And so I think that your story dispels a couple of myths, and it's incredibly powerful. So I'm really excited about this conversation.
Same here, man. Same here.
So why don't you take us back a little bit to that day? Tell us what that day was like for you.
Absolutely. It was almost more of a lead up over the course of a few days. There was a migraine that ended up kind of kicking everything off. And then from there, I started to notice more and more the amount of pain that was happening kind of toward the back and on the side. It just wouldn't stop. From there, I just started throwing up. I couldn't stop throwing up. It lasted for hours. And I ended up going to urgent care as a result. They gave me a shot of Phenergan to calm me down, stop the vomiting. I passed out for a few hours, and I thought, okay, maybe this is it. Maybe I'm all right. So I get up after sleeping a little bit, only to realize I can't move my body right. I'm 41 years old and nothing's working. I try to move an arm just to kind of push myself off the bed to get up, and my leg moves. Not only does it move, but it moves in the wrong direction and with the wrong amount of intensity. So it was like everything was kind of jumbled up. All of my body parts were kind of out of my control. So it was terrifying, man. It genuinely frightened me because I didn't understand what was going on. Here I've been behaving in a certain way for my entire life. You expect to be able to move, and suddenly you can't move, right?
Yeah.
So I realized like something's going to have to happen here. I didn't even call my wife in because I couldn't get the words out. When I finally got out of bed, I fell out of bed. And the only reason my wife came to check on me was because she heard this really loud thud. She was on the first floor, I was on the second. She happened to be directly below me, and just boom, I hit the ground. So she calls EMS. They come to get me. The entire time I'm a pretty naturally free-flowing, sweaty guy. But this was insane. I was covered from head to toe in sweat, and I couldn't stop. So the EMS finally comes. It felt like ages. I'm sure it was very quick, but they had to pick me up. They had to load me up. They put me on this thing that had like, it was like a chair with tank treads. They had to strap me in, and they bring me down, and I'm in the ambulance for what felt like forever. Eventually, they take me to the hospital. It's a couple of hours later, and I'm finally done throwing up, and I'm starting to kind of come to. I'm really weak, but then eventually I'm able to kind of verbally communicate. Then I'm starting to kind of regain some of my physical faculties. I'm able to move around a little bit better. Things are starting to make a little more sense to me, but I still feel kind of frightened. The doctors didn't really understand what was going on at this point. You know, I'm admitted from the ER into the actual hospital. They start running a few tests, and they find out, hey, there's a stroke. They didn't understand what was happening, why I had the stroke at the time. They kept throwing around the term cryptogenic. So that part was terrifying.
Yep.
You know, learning that I've been doing things a certain way my entire life, and then all of a sudden there was this massive shift, this massive change in everything. And so after the diagnosis of the stroke, it turned into, well, what do I do now? What happens next? And so I'm greeted by PT and OT in my hospital room. The PT was this woman. I'm a pretty short guy to begin with. This woman was maybe a foot shorter than me, and she had this crazy belt, and she was basically underneath me as I'm trying to learn how to walk. Because, I mean, not only was I weak as a result of the stroke, but I realized that I didn't have coordination on my right side. I'm going to pause because I feel like I've been talking for a minute here.
No, I mean, this is your story. This is your experience. And I think you said a lot of things that are really key. Like, one, a lot of times when people have a stroke, they don't know what's going on. And even when you get to the ER, it's not always so clear, right? Because we always say, oh, if you've got a facial droop, if you're just weak on one side, if you can't speak. But there's so many other things that can be happening because your brain literally controls every aspect of your life and of your body, right? And so when you describe, like, look, my perception was off. I was like sweating profusely. Your brain is responsible for all of that. And so it's not always so clear what's going on. And so when you say that they use the term cryptogenic, what it really means is that they didn't know what was going on, and they didn't know why they're seeing that you're having a stroke on whatever scans that they did for you.
Yeah.
So what was that experience like when you were first in the ER? And, you know, your perception's off. I'm sure it's chaotic. The providers aren't really sure what's going on. That must have been a scary feeling.
It definitely was. And, you know, where it was particularly weird is finding out my wife can't come into the hospital because of COVID.
Yeah.
Eventually she was able to come in. And so, you know, not only it has this kind of life-altering event just occurred, I'm alone. I'm doing this solo.
Yeah.
And so the nurses and the doctors and the techs, they were spectacular. They were genuinely amazing in terms of keeping everything very human. The conversations, you know, when I'm nervous, I'll tend to deflect, and I'll happily inject a little humor and humanity into a situation. I was really thankful that the nurses ended up doing the exact same thing. um, the levity was really needed, because I think if I hadn't had the ability to joke around, I would have gone insane. So,
Yeah.
uh, you know, the hospital was chaotic, but it was an organized chaos, if that makes enough sense. It was, you could kind of tell that it was like, okay, they know to expect the unexpected. It wasn't an ideal situation, but I felt like there was at least enough of a plan of, okay, well, we need to check these boxes for this guy to make sure that we're ruling out all these different things. And it wasn't until I had left and actually returned, which is, I guess, kind of the second half of the story, that the hospital ended up finding out what had caused the stroke to begin with. Do you want me to dig into the second half there?
Yeah, go right ahead.
Yeah. So I found out that men of a certain age can be prone to vertigo.
Yep.
So I ended up going in to the hospital a second time because I was freaked out. I was starting to experience really similar symptoms to the stroke: dizziness, really high blood pressure, and that overwhelming sense of anxiety of like, okay, well, I don't feel like I'm in control anymore. What's happening right now? And so as a result, they started running all these tests. They ran tests with the thought of, this dude's having a second stroke. The other shoe is dropping right now. This guy is probably gonna die if we don't do something. It turns out it was just really bad vertigo. And as a result of them taking all these precautions and running the tests that they ran, they ended up finding a dissection. So a tear in the artery, in the artery that was leading up into my brain. The stroke ended up happening in the cerebellum. And that's why the motor function was so heavily affected. I was told by my neurologist, she was spectacular. My neurologist in the hospital, Dr. Bosk, ended up letting me know. She was like, if this had occurred any other part of your brain, we wouldn't be talking. Either you would be in a vegetative state or you would be gone. So because of the size of the stroke, they were really cautious about everything. But long term, the prognosis ended up being about a year to regain just about all my faculties. I'm at about, I'd say like 95% in terms of like where I was before the stroke. I'm 20 pounds lighter, which is pretty nice, and I know that you'll want to touch on that in a little bit as well. But I'm able to drum again, which is I'm really thankful for. Some days are definitely better than others. I definitely had a kind of Tuesday and Wednesday in terms of drumming. It was a bit of a stroke day, so wasn't working as well. It was a little delayed, but this entire chain of muscles is still affected to this day, and it goes on into my back to where I'm having to like roll with acupressure. I'm on a lacrosse ball for about a half an hour to an hour every single night, just to work through the muscle soreness. And it's kind of one of those things I've accepted. I don't love it, but I acknowledge this is kind of a part of the new normal of, okay, this thing happened, and it's sort of like, in order to keep living and to live with less pain, you're gonna have to make some adjustments.
Sure. And you actually you wrote an article about your recovery process. And for those of you, you can actually read the article. I put a link in my bio, and it'll be up there for the next couple of days. And you can also tell them where they can find the article on your end. But why don't you tell us a little bit about your recovery process?
Yeah, yeah. So PT, OT, and speech therapy were pretty much immediate. So the PT I was able to blast through actually pretty quickly. The in terms of what was affected, the the biggest problem wasn't strength. That was never an issue. It was coordination.
Yeah.
And so the things that my OT had me doing were things like, making sure that I was like able to pick up things, especially with these two fingers here. Being able to pick up a penny, which, God, when do you ever do that? But
Right.
it was about reconnecting with that mind muscle memory. And so being able to pick up pennies and solve little puzzles, one of the first things that I ended up doing as a genuine hard homework thing related to OT, I ended up solving a 500-piece puzzle using my non-dominant hand, which I would never wish it on my worst enemy because it was dreadful. It
Yeah.
was it was horrible, but it took hours, and it was exhausting. It was mentally exhausting trying to remake that connection to an area that I just had not really been that connected with in the first place. I'm thankful it was my non-dominant hand. So the recovery period that ended up taking place there, so there was PT, blasted through that quick. OT, it took a little longer, a couple of weeks longer, and then speech therapy. For some reason, that was the hard one for me.
Yeah.
I found out I was apparently hardwired for a stutter, and it just had really good coping skills my entire life. And so my speech therapist ended up working with me on breathing techniques, and these are all things that are in the article that you mentioned,
Yeah.
the Medium article. You know, we did timed breathing exercises, and I started to come to realize that even though I can feel a little bit of the droop in here, most people, in fact, my wife doesn't even see it if I'm like this. The other day she saw me like upside down. My head was like opposite hers, and she looked over. She's like, "Oh, I can kind of make it out. There's the slightest difference from what I
Yeah.
remember your face looking like." So, recovery has been challenging. It's been really quick for everybody outside of my immediate circle. It feels like it's taken forever for me, even though I know that this has been a really quick recovery in the grand scheme of things. It's only been about 4 months that it's really taken. But trying to do the things that you're so accustomed to doing for the majority of your life, and then realizing you've got to rethink how you do this. You've got to undo not only what the stroke did, but potentially, 40 some odd years of bad habits. It's challenging. It's
Yeah.
challenging.
You know what I really love about your story is that you did the work, right? So you had a stroke in your cerebellum, and the cerebellum is responsible for coordinating your movements, like you said. And so often when we see people have a stroke, they want the meds, and the medications may help prevent a future stroke, but it really takes work to get your brain to heal. And that's the work that you're doing. And I think that that's such a powerful message, that if you do the work, that your brain is capable of a tremendous amount of healing. And so I think that what you've been doing is really inspiring for a lot of people.
Thank you. Thank you. It's, in the grand scheme of things, honestly, I've talked with other stroke survivors. Whether on Instagram, whether at work, and I realize just how fortunate I am in the grand scheme of it all. I mean, I'm young, which is part of why I've been able to bounce back. It was an ischemic stroke, which is another reason I was able to bounce back, because I've, the other folks that I've talked to, either it was, a hemorrhagic stroke, or it occurred in a different part of their body. This stuff is no joke, man. It's scary. I mean, I was already on a bit of a weight loss journey to begin with. I mean, I'd already lost about 50 pounds in about the year and a half prior. But, due to COVID, I put on the quarantine 15, the COVID-19 pounds, and it was like, okay, so, I'm eating terribly, and I'm not exercising, and part of me wonders, and we could wonder all day, obviously, but part of me wonders if any of this would have really happened if I'd continued to take better care of myself.
Yeah.
And now the recommendation is that I'm on 2 grams of salt a day, and that's it. My God, salt tastes good.
It's addictive, right?
Yeah. And
Yeah.
I've got, I mean, I saw on here my, I saw my mom and my wife are both on the call here, and they can attest. I love me some salt, and I was born in South Louisiana, where without salt, I mean, I feel like as your Haitian background, I feel like
Listen,
you can relate.
the food is incredibly good. It's incredibly addictive. But it's not the best for you,
No,
right? And
no,
so sometimes I know, like, yeah, when I'm eating certain foods, and even when my family's cooking, like, I got to take a step back,
yeah,
you know.
yeah,
But I think that brings up a great point. There's a term, it's an old term, but still kind of gets used for strokes, called cerebrovascular accident. And a lot of times we stay away from that term because often there is nothing accidental about a stroke. There are actually things that are occurring in our life that we can do to minimize our risk of stroke. And it's a lot of the things that you're doing now. It's about eating healthier. It's about exercising on a regular basis. It's about minimizing your stress. So those things are incredibly important. I see we've got a question where the question is, does recovery help if the patient is highly intelligent like you are? And I think what makes you incredibly inspiring is that it's not just that you're intelligent, it's that you're willing to put in the work. And a lot of people, what happens is, let's say if they're paralyzed on one side of their body, they stop trying to even use that side of their body. They just try to compensate with the other side. And you actually have to continue to engage that side of your body. You've got to exercise it, because your brain is capable of healing, and it can heal weeks, months, and years down the line. But you've got to be stimulating it the right way. And so, the fact that you've put in the work is what's really important. It shows your commitment, your dedication to getting healthy, to getting back to the life that you know, to being everything that you can be for your family, your wife, your children. So I think it's incredibly inspiring. And for me, sitting sort of on this side as a neurologist who often takes care of people with strokes. So I'm in there when it's an emergency situation, right? Where it's a little bit chaotic, where you're trying to figure out what's going on. And I never get to have a sit down like this with somebody where you're like, well, what really was it like for you, right? What was truly your experience? So, for me, this conversation is really awesome and just really inspiring. So I want to thank you for that. Any advice that you would give to people who potentially have had a stroke?
Yeah. I mean, so there's an author. In fact, I've got a couple of her books back behind me. There's an author by the name of Tara Brach, and she writes about this concept called self-compassion. One of the books is called Radical Acceptance, and that book completely changed the way that I was approaching life before the stroke. But now more than ever, I'm realizing that I've got to just cut myself some slack. And so to everybody out there, self-compassion is it's such a necessary skill. You know, the amount of times that I've been trying to figure out the right words and formulate the right thing in my mouth as we're talking, it's not like I'm having to think as much about it as I would have 4 months ago. But the only way that I've been able to get to where I'm at right now is through that concept of self-compassion. And so basically the way the concept works is we're great when it comes to being friends with people. We're really nice to people that we love, that we have in our lives. And in fact, just acquaintances that we're not even that close with,
Right.
we can be really good with them, right? But where we can be really cruel, where we can be really mean, is the amount of pressure that we put on ourselves. And so on a regular basis, we're so often completing something, and instead of sitting with that victory for just a little bit, we're thinking to ourselves, yeah, I did that, but what's next? What can I do to top this? And it feels constant. We're in a hustle culture now. You know, I mean, just us being on Instagram Live in some ways, you know, there's a hustle culture that's involved.
Yeah.
And so oftentimes it's, well, what do I do next? At some point, we have to stop and self-validate and remind ourselves that I'm going to treat myself as well as I would treat my best friend, or as well as I would treat even just an acquaintance. And because so oftentimes we don't grant that to ourselves. So
Yeah, and
I think out of everything I could say, it would be that.
And I think that you're spot on. I think that's a really empowering message. You know, even in my life, I see it in the lives of my patients, family, and friends. You know, we're just always moving to the next thing. And I think taking the time to really appreciate who we are, to love who we are, to appreciate our accomplishments, and not worry about the things that didn't go perfectly. I think that's really, really important. And so I really love that message. Any last word for people who are potentially watching this?
Yeah, I mean, if you, so there's an entire circle of people that you can lean on, that you're allowed to lean on, that want you to lean on them. Do that, lean on them, but know that down the line they're going to start leaning back, and that it's okay to lean on them. And one thing I do want to bring up, just because I realize we're starting to close here, but one thing I want to make sure that I draw attention to as well. I didn't call out beyond the PT, the OT, and the speech therapy. I've been doing gua sha therapy, which is a form of deep tissue massage, as well as acupuncture.
Yeah.
Get on that stuff.
Right.
It's you want to talk about putting the work in. The gua sha can actually be kind of painful. But I noticed almost immediately, like, my ability to, just everything woke up during that time of receiving the acupuncture, receiving the gua sha. I was using a brush as well to kind of wake those nerves back up and build that connection. So it's all about patience, Doc. It really is. I don't know that there's a whole lot else other than allowing the patients to combine with that self-compassion, and that you don't have to have a stroke to bring that into your life.
Yeah.
And so, just like what you're talking about in terms of overall preventative living and the importance of that, I think on an emotional level, you also have to bring that in. So eat right, treat your body well, but treat what's inside of you with the same level of respect, and you get to live a whole lot longer and a whole lot better.
Yeah. Look, man, you're doing some great stuff. You're doing some great work on you, and you are having a really positive impact on others. I think this conversation has been certainly the highlight of my week, maybe my month, probably the best moments of my year.
Thank you.
So, so thank you so much for this. Anything else you want to highlight before we close this out?
No, I think that's it for me, man.
Well, again, you should check out Devin's article. You can find the link in my bio. It's a really powerful article about his recovery. And and hit this brother up because, he's not only changing his life, but he's changing the life of other people. So thank you so much.
Thank you, Doug. Appreciate it. Thanks, y'all, for joining.
Thank you, guys. Take care.